have been extremely grateful to be able to work with some brilliant and passionate people in my time with the Rare Diseases Implementation Group. The individuals impacted by rare diseases are often living with challenging symptoms that affect lots of different parts of their body, and yet they strive to tell their story and make a difference for others in the same position.
My experience of rare disease was that when I was about 8 or 9, 10, my family discovered that there was a rare disease in my family that came down from my father, and that my sister and I, although there was only a 50% chance of inheriting it, both my sister and I had inherited it, and that is Schweinberg syndrome, and it has different manifestations in different people. For example, I was born deaf and had an operation when I was nearly 3 to restore my hearing, and my sister is deaf in her left ear and she had quite a lot of birthmarks. There's just lots of different genetic displays of it in different people.
I actually have a rare autoimmune condition myself. My son was tested 9 years ago. He has an unknown condition, more commonly known recently as a swan condition. There's a lot of queries surrounding him, so between myself and his appointments, we've gone everywhere, even over to England at some points to see specialists over there. Nobody can really tell us what's going on with him though. For me, I've had to go to London to see specialists, hematologists and rheumatologists all the way down there. I actually have a name for my condition, but he doesn't, and he's the one that's really confusing everybody.
I think for me it's having earlier diagnosis, because in my family's case, had my father known about the genetic disorder that he carried, he could have made decisions about whether he had children or what he did. And even when it was discovered there wasn't much genetic counselling available then for either my sister or I, or just being able to talk about the way it had affected us and our childhood. So just more support and more counselling and help, I think.
For everybody, whether they are doctors or nurses or even carers and hospital transport and stuff like that, you know, just for people to understand that just because it's rare, it's real. It doesn't mean that it's impossible for things to happen, because, you know, with the rare community, it's unknown. There's a lot of unknowns about it.
Working alongside the other nations in the UK, teams across the world, Genomic Partnership Wales and the Genetic Alliance, I feel that we have the potential to make a huge difference to the group of individuals who have previously struggled to get the support they deserve. Collaborating with organisations to help patients get a final diagnosis faster is crucial and is supported by our new genomic strategy. We have a long way to go to increase awareness of rare diseases within the healthcare sector, where historically it hasn't been prioritised, but the action plan gives us a mandate to drive these improvements. We know what works within some rare disease conditions, some gold standard service provision across Wales, such as cystic fibrosis. Our vision is that all those with rare diseases can access this level of support, with improved access to support, the ability to be involved in research and access appropriate treatment. Thank you to all those who help support this really important work.